Welcome to our channel. Today we are going to explore a topic of great relevance for those who suffer from coagulation disorders. Which anticoagulant is better, Sintron, Warfarin or Eliquis? We will dive into a detailed, scientific analysis to understand the advantages and disadvantages of each medication. This video has been produced with reliable information from world-renowned universities and institutions. In the description you will find a list of all the references and studies cited in the video. Introduction: Anticoagulants are crucial medications to prevent blood clots from forming in people with certain medical conditions, such as atrial fibrillation, deep vein thrombosis, and pulmonary embolism. Three of the most common anticoagulants are Sintron, Warfarin, and Eliquis. Sintron and Warfarin, both vitamin K antagonists, have been used for decades. Eliquis, with apixaban as the active ingredient, is a newer anticoagulant known as a direct factor XA inhibitor. All of these medications have their advantages and disadvantages, and the choice between one or the other depends on several individual factors. Let's analyze these aspects in detail. Sintron, acinocumarol. Benefits of Sintron. 1. Experience and cost. Sintron has been in use for over half a century, providing extensive clinical experience and long-term data on its efficacy and safety. In addition, it is a generic drug, making it more affordable compared to some newer blood thinners. 2. Close monitoring. Patients taking Sintron require regular monitoring of their INR, International Normalized Ratio, to ensure that drug levels are within a safe therapeutic range. This allows for precise and personalized dosage adjustments, minimizing the risk of bleeding or blood clots. 3. Reversibility. In an emergency, the effects of Sintron can be more easily reversed with vitamin K, which can be a significant advantage in severe bleeding situations. Disadvantages of Sintron. 1. Food and drug interactions. Sintron has numerous interactions with foods rich in vitamin K, such as green leafy vegetables, and other medications. This can complicate treatment management and requires strict adherence to dietary and medical recommendations. 2. Frequent monitoring. Although regular monitoring can be a benefit, it can also be seen as a disadvantage due to the need for frequent doctor visits and blood tests, which can be inconvenient for some patients. 3. Variability in response. Response to Sintron may vary significantly among individuals due to genetic and other factors, which may complicate dosage adjustment. Warfarin. Benefits of Warfarin. 1. Extensive clinical experience. Warfarin has been the standard of care for more than 6 decades. This has allowed for a vast collection of data on its long-term efficacy and safety. 2. Cost. Similar to Sintron, Warfarin is a generic medication, making it affordable and accessible to most patients. 3. Effective reversibility. Warfarin can also be reversed with vitamin K in emergency cases, offering an additional safety measure for patients at risk of bleeding. Disadvantages of Warfarin. 1. Significant interactions. Warfarin has numerous interactions with foods and medications. Patients must maintain a diet consistent with vitamin K and avoid certain medications, which can be restrictive and difficult to manage. 2. Requires frequent monitoring. Like Sintron, Warfarin requires regular INR monitoring to keep levels within a safe therapeutic range. This involves frequent visits to the lab for blood tests. 3. Dosage variability. Warfarin dosage may vary widely among patients due to genetic differences, requiring precise, individualized dosage adjustment. Eliquis, apixaban. Benefits of Eliquis. 1. Efficacy and safety. Clinical studies have shown that Eliquis is as effective, or even more so, than Warfarin and Sintron in preventing stroke and systemic embolism in patients with non-valvular atrial fibrillation. In addition, it presents a lower risk of major bleeding, which is a crucial aspect in anticoagulant treatment. 2. Less need for monitoring. Unlike Warfarin and Sintron, Eliquis does not require regular INR monitoring, which significantly simplifies treatment management and improves patients' quality of life. 3. Less restrictive interactions. Eliquis has fewer interactions with foods and other medications, allowing for greater flexibility in diet and in the administration of other concomitant treatments. Disadvantages of Eliquis. 1. Cost. Eliquis is significantly more expensive than Warfarin and Sintron, which may be a barrier for some patients, especially those without adequate insurance coverage. 2. Limited reversibility. Although there are specific agents to reverse the effects of Eliquis in emergency cases, such as andexanet alpha, these may not be available everywhere and may be expensive. 3. Relative newness. Although current data is very promising, Eliquis is a relatively new drug compared to Warfarin and Sintron, meaning very long-term data are still developing. Comparative Studies 1. Aristotle Study, 2011. This study, published in the New England Journal of Medicine, compared Eliquis with Warfarin in patients with non-valvular atrial fibrillation. The results showed that Eliquis significantly reduced the risk of stroke and major bleeding compared to Warfarin. 2. Amadeus Study, 2007. Published in The Lancet, this study compared the efficacy and safety of zimelagatrin with vitamin K antagonists such as Warfarin and Sintron. Although zimelagatrin is not in clinical use, the study provides valuable information on vitamin K antagonists, highlighting the need for regular monitoring and the variability in individual response. 3. RLY Study, 2009. This study, also published in the New England Journal of Medicine, compared dabigatran, another new anticoagulant, to Warfarin. Although not directly compared to Eliquis, the findings suggest that the new oral anticoagulants may offer significant advantages in terms of safety and convenience. Individual considerations and recommendations. 1. Patients with limited access to health services. For those living in areas where access to regular INR testing is difficult, Eliquis may be the best option due to the reduced need for monitoring. 2. Patients with high risk of bleeding. According to the aforementioned studies, Eliquis may be preferable for patients with a high risk of bleeding, since it has a more favorable safety profile in this regard. 3. Cost and accessibility. For patients who cannot afford the high price of Eliquis and have good access to healthcare services for regular monitoring, Warfarin and Sintron may be viable and effective options. 4. Dietary considerations. Patients who have difficulty following a strict low vitamin K diet may benefit more from Eliquis, given its lower number of food interactions. Conclusion. In summary, the choice between Sintron, Warfarin and Eliquis should be individualized, taking into account factors such as accessibility to health services, risk of bleeding, cost and dietary considerations. All of these medications have their own advantages and disadvantages, and the best choice depends on each patient's particular circumstances. It is essential that patients discuss all of these considerations with their physician in order to make an informed decision that is appropriate to their needs. If you found this video useful, don't forget to give us a like and subscribe to our channel. Thank you very much.